Thank you for your interest in Lasso Healthcare and the Medicare Medical Savings Account Plan, better known as the MSA. This video will inform you on several topics. 1. An overview of Lasso Healthcare. 2. The types of Medicare Advantage plans available and where the MSA plan fits in that portfolio of options. 3. The basics of an MSA plan and how it works. 4. Who is eligible to enroll, as well as the enrollment and disenrollment periods. 5. Benefit design, including monthly premium, deductible, and deposit amounts. 6. Information about the medical savings account through Optum Bank. 7. Accessing providers and care in an MSA. And 8. How to enroll. Let's begin with a short discussion about Lasso Healthcare. Lasso Healthcare is a health insurance carrier formed in 2019 with a specific focus on the Medicare Advantage MSA. In a very short time, Lasso Healthcare has become the nationwide market leader of MSA plans. To support this growth, Lasso Healthcare partners with industry-leading experts to provide customer service, claims processing, and bank account administration. It's important to understand the financial viability of your health plan and insurance carrier. Since Lasso Healthcare is too new to be evaluated by organizations like AM Best, we want to assure you that Lasso Healthcare currently meets and in most cases exceeds the various capital or money requirements for insurance carriers set forth by each state's Department of Insurance. We also partner with a national leader in reinsurance of health plans to reduce financial risk. And of course, our partnership with licensed insurance agents across the country supports prospective members and assists with service while you are a member with Lasso Healthcare. There are many types of Medicare coverage options available, including Original Medicare, Medicare Supplement, Medicare Advantage, and prescription drug plans. The Lasso Healthcare MSA is one of several different types of Medicare Advantage plans. You may be familiar with an HSA, or Health Savings Account plan, which is often offered by employers to cover their employees' healthcare expenses. The MSA plan is somewhat similar and often a great Medicare option for those with experience as an HSA plan member. The MSA plan design features high-deductible Medicare coverage paired with a special medical savings account. The savings account is an important part of the MSA's overall value. We partner with Optum Bank, a market leader in both Medicare medical savings accounts as well as health savings accounts. The MSA is a relatively simple plan design. Lasso Healthcare deposits a set amount of money into your special savings account each year you are a plan member. You decide how to use the money. You can spend, save, or invest the funds. We recommend reserving the money to pay for Medicare-covered medical expenses. The MSA is a high-deductible plan, and you are responsible for paying 100% of charges before the deductible is met. The intent or purpose of the deposit is to help offset those expenses. Once the deductible is met, Lasso Healthcare pays 100% of Parts A and B Medicare-covered services. If you have deposit money remaining at the end of the calendar year, it belongs to you and rolls over to the next calendar year, regardless if you stay in or leave the plan. If you remain a member, the next year's deposit is added to your account, and you can begin to see how you can grow your money over time. Before discussing the MSA plan in detail, let's discuss the eligibility requirements to enroll in an MSA plan. MSA plans have several specific requirements for enrollment. For any Medicare Advantage plan, you must be Medicare eligible. You must live in the Lasso Healthcare MSA service area, consisting of 34 states plus Washington, D.C. You must reside in the United States for 183 days or more during the calendar year. You may not have other health coverage that would cover the MSA plan deductible. including benefits under an employer or union group, TRICARE, the Veterans Administration, or Federal Employees Health Benefits Program. For example, if you are enrolled in VA coverage, you are not eligible to enroll in the MSA. You could enroll in, for example, a Medicare Advantage HMO plan with prescription drug coverage and still remain enrolled in your VA benefits plan. However, since the VA benefit could be used to cover the Parts A and B medical expenses from services received at a VA facility, those expenses normally would apply to the MSA deductible, and thus, you are not eligible for the MSA. You must not currently be eligible for Medicaid benefits, and you cannot currently receive Medicare hospice benefits. Lasso Healthcare's MSA plan offers unique features to take control of your healthcare expenses and maximize the value of your health plan. MSAs are the only Medicare Advantage plan option that gives you money. Members receive a deposit each year they are a plan member. Unused funds at the end of the year belong to you and can accumulate over time. MSA funds can also be invested for additional growth opportunities. MSAs give you access to any Medicare provider in the country agreeing to treat you. It's one of the most flexible provider access options among Medicare Advantage products. The deposit can be used tax-free on all IRS-deemed qualified medical expenses, even those that may not otherwise be covered by Medicare Parts A and B, such as eyeglasses or prescription drug copays. By law, MSA plans are not allowed to charge a monthly premium. Unlike most other Medicare Advantage plans, the MSA allows you to pair any individual prescription drug plan available in your service area. This means you can pick a plan that best meets your prescription drug needs. And lastly, our health incentive program rewards members for taking proactive steps in managing their own health. Earn up to $250 in gift card rewards to major retailers. With so many features, the MSA appeals to many individuals. Individuals historically enrolled in an HSA plan who may have accumulated savings in that account and want to continue accumulating funds once Medicare eligible. Travelers, as the MSA's clinical access flexibility allows you access to Medicare providers in all locations. Those with chronic conditions who are managing their health care closely. Health enthusiasts who enjoy the flexibility of the savings account and the potential to accumulate savings. Current Medicare supplement members who can realize substantial savings when moving to an MSA plan with a $0 premium. Compared to other Medicare Advantage plan types, there are additional rules regarding when you can join or leave an MSA plan. The most popular time to enroll in an MSA is the annual enrollment period, or AEP, from October 15th through December 7th each year. If enrolling during this time, membership begins on January 1st. The annual enrollment period is a great opportunity each year to review your coverage options and any changes in your health to determine if your plan is the best fit for you. If disenrolling during this time, membership ends December 31st. The other opportunity to enroll in the MSA is during an initial coverage election period, or ICEP. This is the time in which you are first eligible for or enrolling in Medicare Parts A and B. ICEP includes your birth month or entitlement month, plus the 3 months before and the 3 months after your birth month. Other enrollment periods, such as the open enrollment period or OEP between January 1st and March 31st each year, and the OEP new, the 3-month period following your first ever enrollment into a Medicare Advantage plan, are not valid periods to join or leave an MSA. Special election periods, or SEPs, are limited to several scenarios that only allow for disenrollment from an MSA, such as moving permanently out of the Lasso Healthcare service area, gaining Medicaid eligibility, enrolling in other coverage that also covers your MSA deductible, such as employer coverage. If there is a 5-star Medicare Advantage plan available in your service area and you wish to enroll in that plan mid-year, you can disenroll from an MSA plan. MSA enrollment is generally for a full calendar year, and the plan deposit and deductible amounts are stated as full year amounts. As such, the month in which you enroll in an MSA plan impacts your deposit and deductible amounts. Those amounts are prorated monthly for members joining or leaving the plan within the calendar year. For example, if your MSA coverage starts January 1st, you will receive the full deposit and the full plan deductible amount applies. If your MSA coverage starts April 1st, there are 9 months remaining in the calendar year at that point, so your deposit and deductible amounts are prorated for the remaining 9 months. If your MSA coverage ends July 1st, there are 6 months remaining in the calendar year that you won't be an MSA member, so you owe a 6-month prorated deposit amount back to Lasso Healthcare. When you remain enrolled through December 31st, you keep any unused deposit funds received that year. If you remain enrolled for the next calendar year, the new full-year deposit is added to your account at the beginning of the next calendar year. The custodian of Lasso Healthcare's medical savings accounts, Optum Bank, offers special benefits to Lasso Healthcare MSA members. 1. No custodial fees as long as you remain a Lasso Healthcare member. If you disenroll from the Lasso Healthcare plan and keep your account with Optum Bank, the account is subject to a monthly fee, but you keep both the account and any accumulated deposit, earned interest, and any investment amounts. 2. You receive a debit card linked to your account for accessing and using MSA funds. 3. There is no minimum balance, so even if you use all of your funds in a calendar year, you will not pay a bank fee or penalty. 4. The account does earn interest. Contact Optum Bank for current rates. 5. Monthly statements are available to assist in managing your account balance. 6. Lastly, Optum Bank gives you the option to invest any balance amount over $2,000 to potentially grow your funds. Expenses and how they count toward your Lasso Healthcare plan deductible and your income tax impact are important to understand. From an MSA perspective, there are 3 major categories of expenses: Medicare-covered expenses, other qualified medical expenses, and non-qualified expenses. Medicare-covered expenses are anything covered under Medicare Parts A and B. This would include most doctor visits, hospital stays, and lab tests, and all other services included in Parts A and B. These Parts A and B expenses are a subset of what the IRS has defined as qualified medical expenses, or QMEs. QMEs are services and products the IRS allows you to deduct as medical expenses on your yearly income tax return. There are many QMEs defined by the IRS, and a full list of those can be found on IRS publication number 502. The QMEs that are not covered by Medicare make up our second category. These non-Medicare QMEs include products like Part D prescription drugs and services like dental, vision, and long-term care. The final expense category is non-qualified expenses. Anything that is not a QME falls into this category, such as entertainment, clothing, food, automobile payments, house payments, utility payments, and more. Let's now take a look at how these expenses relate to the MSA. Firstly, you can use your MSA deposit funds on any of these expense types. Lasso Healthcare does not dictate how you spend the deposit. You choose how to spend, save, or invest the funds. You will not incur tax or penalties when you use deposit funds on Medicare-covered and non-Medicare-covered QMEs. You will incur tax and penalties when you use deposit funds on non-qualified expenses. We will discuss additional tax implications in the next section. Any money spent on Medicare-covered expenses, either from the deposit or from your own funds, counts toward the MSA plan deductible. As the deposit provided is less than the plan deductible, you will have some out-of-pocket expenses to cover on your own before your coverage through the plan begins. Once you meet the deductible amount, Lasso Healthcare covers any additional Parts A and B expenses at 100%, with no limit to the amount. Any money spent on non-Medicare QMEs, either from the deposit or from your own funds, does not count toward the MSA plan deductible. As these do not count toward the deductible, there is no point at which the plan covers or pays for these items. These will always be your responsibility to pay for, but keep in mind you can use your MSA funds to pay for these items without incurring tax and penalty. Any money spent on non-qualified expenses, either from the deposit or from your own funds, does not count toward the MSA plan deductible. As these do not count toward the deductible, there is no point at which the plan covers or pays for these items. These will always be your responsibility to pay for, but keep in mind, using your MSA funds to pay for these items will incur tax and penalty. Our recommendation is to save your MSA funds to offset your deductible responsibility in the event you receive Medicare-covered services. Remember, funds remaining in your account at the end of the year are not use it or lose it, so you can accumulate funds year over year. If you managed your care well and have funds remaining near the end of the calendar year, or accumulated MSA funds from previous plan years, you may want to consider spending a portion of those funds on non-Medicare QMEs like eyeglasses or dental services for tax-free spending. There are a few additional tax implications to consider. The deposit is not taxed upon initial distribution into the bank account. Funds and any gains are not taxed while they remain in the account. If account funds or gains are used for qualified medical expenses, you are not taxed for those withdrawals. You will receive a 1099 SA form from Optum Bank if MSA funds are withdrawn throughout the year. The 1099 SA can be used to complete your tax filing requirements. Regardless of the amount or reason, if you spent MSA funds during the year, you are required by the IRS to file Forms 8853 and 1040, even if you are otherwise not required to file an income tax return. For additional information, please review IRS Publications 969 and 502 and speak with a tax advisor. As you customize the right types and amounts of coverage for you, we think it's helpful to acknowledge that your MSA funds can be used tax and penalty-free to pay copays, coinsurance, and deductibles for other limited benefit policies. Some of the more common coverages to pair with an MSA include standalone prescription drug, hospital indemnity policy, critical illness insurance, long-term care, dental, and vision policies. We often receive questions about using the MSA funds to pay for prescription drug premiums, since the MSA doesn't cover prescription drugs, and it is recommended that you enroll in a separate prescription drug plan. While you cannot use your MSA funds in a tax-free manner to pay for premiums on a prescription drug plan, you can use those funds tax-free to pay for any deductibles, copays, or coinsurance. A long-term care policy is the only supplemental plan where the premium itself is considered by the IRS as a qualified medical expense. Thus, it's the only plan premium you can pay with your MSA funds in a tax-free manner. All of the other policy premiums are not considered qualified medical expenses, meaning you would be taxed and penalized for using your MSA funds to pay those premiums. However, even though the premiums for which you can use your MSA funds on are limited, the copays, coinsurances, and deductibles for all of those policies are considered qualified medical expenses, and your MSA funds can be used tax-free. It is important to remember that those copays, coinsurances, and deductibles will not count toward your MSA deductible. The Lasso Healthcare MSA plan does not include a network of providers, meaning you have access to any Medicare provider. Many providers accept the MSA, including some of the largest and most renowned health systems. Providers can decide at every visit whether to accept the plan and agree to treat you. However, you cannot be denied emergency care due to your insurance plan. Before you receive any services, we encourage you to share our detailed provider guide brochure with your providers and confirm they'll accept our plan. Providers may also call our provider services team for assistance. Since the plan does not have an explicit provider network, it provides a great amount of flexibility, especially for those that travel extensively or have a second residence in a different state. There are several segments of providers, and you can receive the most value by seeing Medicare participating providers. Medicare participating and accepting providers have a contract with Medicare. Payment for their services are capped at the lesser of billed charges or 100% Medicare rates. All Medicare-covered charges incurred from services performed by these providers count toward the MSA deductible. Medicare non-participating providers have agreed to accept no greater than 95% of Medicare rates as payment. However, they can bill you at a limiting charge where allowed by state law. Medicare-covered charges incurred from services performed by these providers count toward the MSA deductible. However, if a non-participating provider balance bills you the limiting charge, those excess charges are not reimbursed by Lasso Healthcare and do not count toward the MSA deductible. Providers who opt out completely of Medicare enter into a private agreement between you and them, either formally or informally. Charges, even those classified as Medicare covered, are not reimbursed by Lasso Healthcare and do not count toward the deductible. Reassuringly, a very high percentage of providers fall into the Medicare participating and accepting category. You can search for these Medicare participating providers on the Medicare.gov website. As an MSA member, visiting a provider works just like it does with other Medicare Advantage plans. At your visit, show your Lasso Healthcare MSA member ID card and tell them to file the claim with Lasso Healthcare. This information can be found on our website or on the back of the member ID card. It's important the provider files a claim with us, even if you have not yet met your plan deductible, so we can ensure the service is within the Medicare-approved amount and help track your progress toward your deductible. Do not show your Medicare card. Our plan does not require a copay or other payment at time of service. Medicare permits its providers to request a copay at the time of service in some instances, even if it's not required by the plan. Lasso Healthcare processes the provider's claim, reprices it as needed, and determines your coverage. We mail you a monthly explanation of benefits, or EOB, showing the coverage decision, progress toward the deductible, and any amount you need to pay the provider. If you've met your deductible, we'll pay the provider directly. If you haven't met your deductible, we notify the provider of your responsibility amount and the provider bills you for your portion of the claim. It is good practice to compare the provider's bill with your EOB to match the billed amount to your determined liability. You can use funds in your MSA bank account to pay any amount due, pay out of pocket, or use a combination of both. If you no longer have funds in your MSA account, you will need to pay out of pocket. Once you reach the deductible, we pay 100% of any additional Medicare-covered expenses. Our member services team is available to assist with any questions you may have regarding claims. Please share our provider guide with your provider, available on our website or by calling member services. The guide educates them and their office staff on the MSA and how to submit claims to Lasso Healthcare for timely payment. The 2021 Lasso Healthcare MSA is now available in 34 states plus Washington, D.C. We call these 35 locations our service area, or where the Lasso Healthcare MSA is offered as a Medicare Advantage plan. Any Medicare-eligible person residing in our service area can select the Lasso Healthcare MSA as their plan. Keep in mind that you can access providers in any state since we do not have a contracted network of providers like other Medicare Advantage plans. In a change from previous years, the 2021 Lasso Healthcare MSA plan options are no longer county-based and limited to just the one plan assigned to your county. For 2021, Medicare beneficiaries across our entire service area will have a choice between two highly competitive MSA plan designs. Our Growth MSA is tailored to individuals looking for lower financial risk. We deposit $2,000 into your MSA bank account. The plan deductible is $5,000. If you apply the deposit to the deductible, it means a member responsibility amount or amount you have to contribute from your own finances of $3,000. Our Growth Plus MSA is tailored to individuals looking for a higher deposit amount. We deposit $3,000. The plan deductible is $8,000. If you apply the deposit to the deductible, the member responsibility amount is $5,000. Let's further explore the value proposition of the Lasso Healthcare MSA, comparing the long-term value of our 2021 Growth MSA plan to a popular Medicare supplement plan, Plan G. We'll discuss two illustrative scenarios: a member with low medical expenses or utilization, and a member with high medical expenses. It is important to note that these scenarios are examples only. The MSA deposit or the Plan G premiums may change year to year. We'll assume a $2,000 annual deposit over the 10-year period for the MSA plan, and an average premium of $120 per month, or $1,440 per year for the Medicare Supplement Plan G, with an average premium increase of 7% annually. Without factoring in medical expense just yet, Plan G's premium cost alone over the course of 10 years is $19,895.69. The Growth MSA has no premium and receives a deposit of $2,000 per year. So there's zero cost to the Growth MSA, and deposits earn you $20,000 at the end of 10 years. Let's now layer in some medical expenses and see how the balances look. This low utilization example uses a medical expense of $500 in year one with a 4% increase in medical cost each additional year. Remember that MSA members are responsible for all healthcare costs until they reach the deductible. In this example, the medical expenses do not ever reach the deductible, and the member pays 100% of those expenses from their MSA account. The cost to the member is $6,003.05 out of their MSA account over the 10 years. Subtracting the $6,003.05 of expenses from the earned $20,000 in deposits equals a total positive balance of $13,996.95 at year 10. For Plan G, the member is responsible for paying only the Medicare Part B deductible before the plan pays 100% for the remainder of medical expenses. That Part B deductible is currently $198 in 2020 and would cost a total of $1,980 over the 10-year period. Subtracting the $1,980 of medical expenses from the $19,895.69 spent on monthly premium costs equals a total negative outflow of $21,875.69 at year 10. Put another way, at year 10, the member in the growth MSA spent $0 of their own money. They spent just the MSA deposit money and earned $13,996.95, while the Medicare Supplement Plan G member spent $21,875.69 and earned $0 over that same time. Of course, having only $500 per year in medical expense may not always be the case. So in our second scenario, we'll consider a member with high utilization over the course of 10 years. The plan comparison of premiums and deposits is the same as the previous scenario, just the medical spend is increased. This scenario also assumes a medical expense of $500 in year 1 with a 4% increase in cost each additional year, with the added expenses of inpatient or hospital stays 7 times in the 10 years. This increased and costly expense of hospital stays quickly has them meet their $5,000 deductible each of those years in the growth MSA plan. In those years, the member applies the MSA deposit amount of $2,000 to the deductible and contributes an extra $3,000 from their own finances to reach the deductible. Over the 10 years, those expenses rack up to a total of $36,882.41 under the growth MSA. But offset those with the 10 years of deposits, and the growth MSA member spends just $16,882.41 from their own finances, compared to $21,875.69 spent for the Medicare Supplement Plan G. Even with these high medical expenses, the growth MSA member is ahead $4,993.28 compared to Plan G. Here's another low-high medical expense scenario comparing Plan G to the Growth Plus MSA. We won't discuss this in detail, but please feel free to pause the video to explore further. It follows the same logic discussed in the previous scenario with the Growth MSA. So we just reviewed the value of the Lasso Healthcare Growth MSA compared to a Medicare Supplement Plan G. Let's discuss a different perspective of value, the time value of money, using the Growth Plus MSA as an example. Remember, the Growth Plus has a higher deductible, but also includes a higher deposit of $3,000. The concept behind time value of money is simple. A sum of money now has greater benefit and value versus the same amount of money later due to the money's potential earning capacity. The MSA is no different. Joining the MSA earlier can yield higher MSA balances. Using our Growth Plus MSA with a deposit of $3,000 annually, our example also includes expenses paid from the account of $1,000 per year, growing to $2,000 per year. Earlier, we discussed some of the investment options available through Optum Bank. Our example includes a 10% return on balances over $2,000 that were invested. The bars in the graph represent the savings balance potential at age 75 if joining the plan at the age noted at the bottom of each bar. For example, with the assumptions listed, if you enrolled in the Growth Plus MSA at age 65, your account earnings could reach $32,484 at age 75. Compare that to someone who joins at age 68. Just 3 years difference in starting age equates to a nearly $15,000 difference in balance. 3 years of $3,000 deposits equals only $9,000. So the earning potential of investments and even interest gained, though not included in this example, help propel the balance an extra $6,000 in those 3 years. If you are considering an MSA plan and interested in the savings potential it creates, the earlier you join, the higher value your MSA balance later. Another way to maximize the value of your Lasso Healthcare MSA plan is by participating in our health incentive program, For Your Health. This program rewards members who take preventive measures in managing their healthcare. Earn up to $250 in gift card rewards by completing 3 easy steps. 1. Complete and return a health survey. 2. Conduct an annual wellness visit and establish a care plan with your provider. 3. Have your provider order labs and discuss the results. Choose from gift card rewards to major brands including Amazon, Walmart, and more, or choose a Visa prepaid card. We encourage our Lasso Healthcare members to adopt a few best practices to assist in maximizing the value of the MSA plan and to better manage their health. Establish a plan to cover the member responsibility portion of health costs. Spend time planning how you'll cover the member responsibility amount now to minimize surprises later. Partner with your healthcare providers and be a good patient and healthcare consumer. It's expensive to be unhealthy. Work with your care team to establish an individualized care plan and focus your efforts on preventive medicine. And be a savvy health shopper. For expenses not covered by Medicare, inquire about alternate care and pricing options before incurring a service. Ask other providers their cost for the same service to find lower pricing. Limit MSA funds used on non-qualified expenses. Unless you've accounted for the extra tax and penalty implications, aim for not spending the funds on any non-qualified expenses. Consider investing excess MSA funds to grow money for future health expenses. If your Optum Bank MSA account balance is over $2,000, consider speaking with your financial advisor about investing the excess balance in other investment vehicles. Enrolling in a Lasso Healthcare MSA plan is easy. Submit a completed application via web, phone, mail, or fax. Once we receive the application, we set up your health insurance plan and work with Optum Bank to open your medical savings account. Once the account is open through Optum Bank, Lasso Healthcare deposits the funds into your medical savings account. You receive both a Lasso Healthcare member ID card and a debit card linked to your savings account. The member ID card you will use when seeing providers, and the debit card can be used to pay for qualified medical expenses. Of course, you can contact us if you have any questions throughout the enrollment process. Enroll today. You can enroll online at lassohealthcare.com. You can call us by phone and speak to a licensed agent. Or you can fill out an application, which can be found on our website, and either mail or fax it to us. You may also find a local agent in your area who is licensed to sell Lasso Healthcare. Thank you for watching, and we look forward to serving you as a future member of Lasso Healthcare. Lasso Healthcare is an MSA plan with a Medicare contract. Enrollment in Lasso Healthcare depends on contract renewal.